Scoliosis is a condition that affects 2 to 3% of the population worldwide and is characterized by a spinal deformity consisting of lateral curvature and/or rotation of the vertebrae. There are two classifications: mild scoliosis, which is usually painless, not progressive, and may not require treatment, and severe scoliosis, which is painful, debilitating, and progresses with age. There are structural and non-structural causes of scoliosis. Structural is where the spine may become fixed in its curved position due to a disease or injury. A non-structural is where the temporary curve in the vertebrae can be corrected. Idiopathic scoliosis is not associated with any other disease, where congenital scoliosis is due to congenitally abnormal vertebrae causing mechanical deviation from normal spinal alignment.
Welcome to Dr. Felipe's Medical Investigations. On today's episode, we'll be talking about scoliosis. Our guest today is a patient who is in denial of his condition, in which a previous consultation was diagnosed to be idiopathic scoliosis.
I often have back pain. Occasionally I get additional pain in my lower limbs, and my mum noticed the vertebrae of my spine form a lateral curvature. This curve may have caused pain due to nerve impingement from the vertebrae directly compressing the spinal nerves. But I can't have scoliosis. I don't even know what that is.
I have here a plain radiograph of a vertebral column unaffected by scoliosis.
Plain radiography is an essential tool often performed in an anterior-posterior projection to prevent magnification artifact of the vertebral column and allow for optimal visualization. Posterior anterior projections may be alternatively performed to limit radiation exposure to sensitive tissues, such as the breasts. A normal vertebral column is a large, radiopaque, segmented linear structure extending from the most superior to inferior part of the medial aspect. The radiopaque bars which extend laterally are the costals. The semi-radiopaque pear-shaped structure, partially superimposed at the medial aspect, is the heart. The large radiolucent structures which lie lateral to both sides of the heart are the lungs, and the semi-radiopaque inferior third of the radiograph is occupied by the thoracic diaphragm and organs of the abdominal cavity.
Insightful! I would now like to introduce Dr. Naomi Hansen, a radiologist who has personally studied Charlie's radiographs and will elaborate further.
Thank you. We first use plain radiography to determine the nature of the lateral curvature and rotation. It is inexpensive, fast, and ideal for diagnosing bone structure deformities such as scoliosis of the vertebral column. Charlie's vertebral column evidently has a large convex to the right and rotation of the spinous processes, indicating he has scoliosis. A Cobb angle is used to describe the severity of the lateral curvature. Let's take a closer look. On the convex of the vertebral column, we can identify the apex of the curve and the terminal vertebra. The terminal vertebra lies superior and inferior to the apex and are those of which the end plates of the vertebral bodies are most angled. Lines drawn from these selected end plates intersect, and the angle between is known as a Cobb angle. Scoliosis is defined as a Cobb angle over 10 degrees.
Wow, so the Cobb angle of my vertebral column is 25 degrees?
You were right. I have scoliosis. What do I do now?
Thank you, Doctor, for joining us today. Now we have orthopedic surgeon Dr. Julia Shield, who is joining us via video call and will be able to answer your questions.
Scoliosis is rarely mistaken for another pathology due to its unique S or C-shaped lateral curvature of the vertebral column. CT scans can be reconstructed into 3D images and is not affected by superimposition. However, it is expensive and uses more ionizing radiation. Here is a 3D reconstruction of a CT scan showing a scoliotic vertebral column. As we can clearly see, this modality increases visibility of the vertebra and the curvature thus formed at T10 and T11. MRI allows accurate visualization of soft tissue and fluid-containing regions of the body. It is more expensive and less accessible, but is used to improve diagnosis of scoliosis if neurological symptoms are present. Studies show 55% of patients with congenital scoliosis have accompanying spinal abnormalities. Here we see a plain radiograph versus a T2-weighted MRI of a patient with scoliosis.
An Arnold-Chiari type 1 malformation is seen here as this protruding intermediate signal structure. The patient also has syringomyelia, in which a large, high-intensity, fluid-filled cyst can be seen in the spinal cord from C5 to T5.
Thank you for joining us, and we'll see you next week on Dr. Felipe's Medical Investigations.